just pass it into law. Thank you. I so submit, Mr. President.
Senator Sadiq Suleiman.
Thank you, Mr. President, my distinguished colleagues. I am Sadiq Suleiman Umar. I represent the good and decent people of Kwara North and who are. Mr. President, this bill is very, very significant because of so much misunderstanding that surrounds NGO operations in Nigeria. KAMA needs to be amended to provide for proper regulatory framework that regulates how NGOs operate in Nigeria. There are several NGOs in Nigeria that have significant impact with huge investment in our health sector, the political space, and a lot of other area NGOs are doing beautiful work. However, there are a lot of persons that use NGOs in a very, very not charitable manners. And today in Nigeria, there seems to be a misunderstanding with a single soup, using a single brush for every NGO in Nigeria. Therefore, with this amendment, Mr. President, this will cover those NGOs that are doing excellent job, that wants to operate by international standard, respect the laws of the country, to be protected. These laws will cover them. For those that, have other ulterior motives in creating NGOs, and they use this limitation in our KAMA to take advantage, they cannot be properly regulated and controlled. I therefore urge us all to support this bill to be read for the second time. Thank you, Mr. President, for the opportunity.
For an act to amend the Companies and Allied Matters Act 2020 to strengthen the operations of non-governmental organizations in Nigeria and their compliance with provisions of this act, and for other matters connected therewith, 2022 second reading taken. And the bill is referred to the Joint Committee on Trade and Investment and Diaspora and NGOs Committee, with the Trade and Investment as the lead committee, to report by Wilson folks. Leader of the Senate. Point of order, Leader of the Senate.
Mr. President, I would like to, with your permission, go to Order 95 of our Senate Standing Orders as amended in 2022. And that order has to do with the committees that we have and the responsibilities of those committees. If within that order we go to item 38, that is committee number 38, that is on page 131 of our standing orders, we'll find that the oversight and other legislative matters that on the Nigerian University of Transport are supposed to be handled by our Committee on Land Transport. Now, this bill that we are doing to formally legalize the establishment of Land Transport University was transferred to the Committee on Education and Tech Fund. So I am trying to make a motion that we amend the earlier reference that we have made, so that we can take this bill on the University of Transport back to the Committee on Land Transport. So I would like with their permission to move that motion, that the reference that we have made.
hankali debating kai mata yau.
I'm still standing on that standing order, but with some modification. What we have been doing before, when we have been considering some of these education institutions, was to sometimes take them to the text one and education, and sometimes to refer them to the committees that are related. We have been doing a lot of things with regard to health. But I think it's important, with your permission, to establish a principle. Wherever the educational institutions are involved, in whatever sector, we send it to the committee dealing with education and text one, with the committee dealing with subject matter and a whole a second committee, so that the consideration of that education issue should be done with the subject matter committee. If this is agreed to principle, I will move this, that, and that for going forward. That is the direction we need to do. It is something I move on to that.
Thank you, Mr. President. I second the motion as amended from the original motion by the leader, that all matters of tertiary education should go to the Ministry of Education, while the specific committee now be added to the Ministry for further consideration. I so second.
Thank you very much, distinguished colleagues. Before I put the question, the issue the leader raised is we have already referred the bill for the establishment of the Federal Universal Transportation to Committee on Tertiary Institutions and Third Fund. And then in our standing order, the supervision or oversight of that institution is vested in the Committee on Land Transport. But what we are dealing with is establishment of the university, not oversighting it. And the principle we are trying to establish henceforth is establishment of any tertiary institution, regardless of what the subject matter is, should be vested in the Committee on Tertiary Institutions and Third Fund, and then the subject matter committee, like in this case, the Committee on Land Transport oversighting that university. The committee takes part in the processing of the bill, but with the tertiary institutions and Third Fund as the lead committee. Is that okay? So that we don't have to be going back and forth. Establishment NUC comes up with certain conditions, and that is the function of our Committee on Tertiary Institutions. So with this, those in favor of this amendment as proposed by the leader and seconded by the minority leader, say aye. Those against, say nay. So the earlier referral is now going to be to the Committee on Tertiary Institutions and Third Fund, and Committee on Land Transport as the other committee, with lead committee, tertiary institutions. Thank you. Leader of the Senate. afternoon. Your mic.
Mr. President, my highest President and esteemed colleagues, the fifth order of the day is the second reading of the Federal University of Medicine and Medical Sciences FEB for this state Establishment Bill 2022. Distinguished senators will recall that the bill was read the first time in this distinguished chamber on Tuesday, 25th January 2022. Mr. President, we wish to invite distinguished senators Smart Adeyemi, the indefatigable Smart Adeyemi, to move the motion for the bill to be read the second time.
Our very distinguished Senator Smart Adeyemi, former comrade.
Mr. President, I rise, Mr. President, to present the lead debates on a bill for an act, Mr. President, to establish Federal University of Medical Sciences, FEB, Kogi State. Mr. President, the proposed bill, the Federal University of Medical Sciences, FEB, when passed, will provide a platform for the ever-increasing need for medical research, reduce billions of naira be spent on medical tourism through the United States, Asia, and Europe. There is urgent need, Mr. President, to develop medical science and encourage our youths to study towards becoming medical doctors and medical scientists. Judging by our ever-increasing population as a nation and the various diseases emerging daily across the globe. In recent times, Mr. President, distinguished colleagues, over 5,000 trained medical personnel from our nation have left for greener pasture to Asia, Europe, and America. This has worsened the poor state of medical services in Nigeria. Today, there are hospitals in rural areas across the length and breadth of our nation without adequate doctors and without adequate qualified medical personnel. Already existing medical facilities of 250 beds and 40 service doctors. There are in existence, Mr. President, 6 main wards: surgical, the maternity, isolation ward, and other wards that are vital to healthcare delivery. The college, the hospital had a training college which was established as a training school to provide qualified and registered nurses and medical personnel. The school has produced high quality nurses and midwives since its inception. Mr. President, with the unwavering support of one of the best governors in this country, Governor Yaya Adozabilo, the school was Distinguished
Senator Smart Adeyemi, you are protected. Go ahead.
Thank you, Mr. President. With the unwavering support of one of the best governors in the Federal Republic of Nigeria, Governor Yaya Adozabilo, the school was recently granted a full re-accreditation by the Medical Council of Nigeria and was upgraded to a College of Nursing Science status to award 8 ND certificates. The college is currently enjoying massive support from the original missionary founders for a comprehensive upgrade of its facilities and infrastructures. These include 3 new giant hospitals and hostels for male, including e-laboratory which has been significantly upgraded, including administrative buildings. There is a dental clinic with a hygienist and a visiting dental surgeon on a monthly basis for the United States to Egbe Hospital. The hospital also offers a mobile health clinic that provides outreach to surrounding poor communities with healthcare needs. Interestingly, Mr. President, there are 3 different centers of education in the hospital campus: the Family Medicine and Residential Program, College of Nursing Sciences, and George Champion Academy. The hospital currently, Mr. President, has 265 staff, including medical, administrative, and maintenance staff, with about 85 various categories of staff accommodation
for senior and junior staff. Let me emphasize that, Mr. President, shortly after the independence, one of the greatest nationals of our time, the late Premier of Northern Region, Sir Ahmadu Bello, the Sadana of Sokoto, gave tremendous support, which explains why this hospital is very much in existence and waxing stronger. There are also new tutorial rooms, study areas, information technology centers, and other needed facilities. These have greatly enhanced the capacity of the school to meet its objectives as an HND level nursing and midwifery certificate for students across the country. The Equa Hospital and its nursing training college program, Kogi State, was established, like I said, by the Canada-based Sudan Interior Mission. It is a 65 multi-purpose bed complex on one hand, comprising others facilities provided. Mr. President, this hospital presently occupies approximately 95 hectares with about 68 buildings, including school of nursing and midwifery, along with those established by this government and the one inherited by given by Sadana of Sokoto as Premier of Northern Region. It is situated on the major intersection between Ilorin and Lokoja and has people accessing it from all over Nigeria. To date, the hospital is adjudged, Mr. President, among the best in the country of Sahara Africa. As a nation, Mr. President, we are blessed with highly intelligent and talented people. We must therefore work towards creating and providing a enabling environment, especially in the educational sector, to harness the clearly present human resources. The establishment of this university, Mr. President, as a specialized center of excellence in the field of medicine will bring to fruition this desirable objective and the vision of our founding fathers. Mr. President, respected colleagues, permit me to equally let you know once again, for your kind attention, the fact that Nigeria has only 72,000 nationally registered medical doctors, with only 35,000 practicing medical doctors, serving a population over 200 million people, as the World Bank minimum recommendation ratio of one doctor to between 400 and 600 patients, which is we are really far behind. This is completely insufficient and requires our very urgent collective intervention. The good news, Mr. President, is that under your leadership as President, effort is being made to encourage the establishment of more medical universities as a way of bridging this gap. Mr. President, I hereby submit that this hospital, as earlier stated, that was established over 72 years ago by missionaries, is one of the hospitals that was catering and is catering for the needs of the people from the whole northern region of the defunct Kaba province. At that time, Mr. President, Kaba province covers part of Kwara, Kogi, Niger, and Benue State. The hospital currently runs courses in nursing and midwifery. Mr. President, I so submit.
Mr. Senator Ike Ekoroma.
Thank you, Mr. President. Very distinguished colleagues. I rise to support this bill for my fellow comrade.
Did you hear what I called him? I said former comrade, so I know you are not a former comrade. Are you?
No, I'm still a comrade, Mr. President. And smart academic can testify to that. Yes, we are still in the struggle. Mr. President, distinguished colleagues, let me commend Smart Adeyemi for his public interest bills recently. I've had cause to disagree with him in respect of some of them, but for this one, I think we're on the same page. Mr. President, as our people say, health is wealth. We need to be alive not to do anything else. So it is important that we establish many medical facilities as possible. We can never have enough of it. Only to emphasize, Mr. President, that while doing this, we must ensure that our people have access to all the medical facilities we can establish in terms of cost. So the insurance scheme for the health sector appears not to be effective and has to be revisited. Secondly, we must ensure that we spread medical facilities to every nooks and corners of this country. Some of us have organized health outreach can testify to the fact that each occasion, people will come from different places with all kinds of complaints. And after that intervention, nothing happens until next year and that person decides to intervene. So we must have a health facility, a health program policy that's available to everyone, that's also affordable. In which the government must make it possible for any person who has any kind of ailment to be able to have access to medical facilities, just as we are doing in the academic sector, universal primary education. There must be a universal health scheme that's affordable and accessible. And of course, you see a lot of Mr. President, another problem is the fact that when you see most of our facilities, the health facilities, they are just hospitals in name. Actually, there are no influence, nothing whatsoever. So, at the same time, they don't really have the resources. The human capital for those hospitals. So, while we're establishing universities for healthcare, establishing hospitals and all of that, we must ensure that there are equipment to those hospitals. We must also ensure that it's affordable. We must also ensure that it's accessible. So, it is our responsibility to make sure that our people have access to the basic things of life, including healthcare, good roads, water, and food. So I want to congratulate Smart Ademi for looking at this direction of providing a medical school for his people, and I believe that not only his people benefit from it, any person around there, and maybe if it's effective and efficient, people can come beyond their state to benefit from this institution. So I second this bill and I support that we read the second time.
Distinguished colleagues, those in favor of the motion that this will be done the second time say aye. Those against say nay. Half of the Senate.
Mr. President, distinguished senators, a bill to act to establish the Federal University of Medicine and Medical Sciences FEB for this state and for matters connected there with 2022 SB 896 second reading.
A bill for an act to establish the Federal University of Medicine and Medical Sciences FEB for this state and for matters connected there with 2022 second reading taken, and the bill is referred to the Joint Committee on Tertiary Institutions and Health Fund and held to report by moving forward. Senate.
The President, my House, the President and distinguished colleagues, the sixth order of the day, the second reading of the Federal Medical Center in the establishment etc. Bill 2022. The distinguished President will recall that the President was the first time in this chamber on Wednesday, 4th March 2020. Mr. President, you will invite the distinguished Senator Olalekan Ramon Mustafa to move the motion for the bill to read the second time.
Distinguished Senator Olalekan Ramon Mustafa.
Thank you, Mr. President Olalekan Mustafa. Mr. President, distinguished colleagues.
Permit me to lead the debate on the bill for an act to establish the Federal Medical Center in the and make provisions for its due management and administration. The bill was read for the first time in this chamber on Wednesday, 4th March 2020. The bill was put together in response to the cries of my constituents, women and children who are in dire need of well-equipped healthcare centers. This move for the establishment of the Federal Medical Center is therefore informed by the need to bridge the existing gap between primary, secondary healthcare and tertiary healthcare delivery in Ogun State in particular and Nigeria as a whole. The gap between primary, secondary and specialist healthcare in Nigeria is widening. There is no seamless transition from one to the other due to a number of factors. The factors include accessibility to medical facilities, affordability of Medicare, as well as inadequate medical personnel at primary and secondary health care levels. Mr. President, distinguished colleagues, communicable diseases have continued to ravage many Nigerian communities due to the distance between the communities and tertiary healthcare institutions. Patients cannot access specialist hospitals where their ailments can be properly diagnosed and adequate treatment given. This unfortunate situation has also compounded the challenge of maternal and infant mortality. Densely populated urban and rural communities are worst hit. Their poor economic situation makes resort to patronizing private hospitals near impossible. The Nigerian National Health Policy is very clear on the role of the different tiers of government in healthcare delivery. Primary healthcare is to be provided by the local governments, secondary healthcare by state governments, and tertiary healthcare by the federal government. In operationalizing this policy, federal medical centers fill vacuums created by either the non-existence or inadequacy of a federal university hospital in a state. The Federal Medical Center, like its counterparts around the world, is envisioned as a multidisciplinary space for treatment, research, harnessing science, and developing innovative means of tackling the numerous health challenges bedeviling the nation. Additionally, when established, the center will perform the following functions: to equip, maintain, and operate the center so as to provide facilities for diagnosis, preventive, curative, and rehabilitative service in medical treatment. Number 2, to support and provide enabling environment for medical training of personnel as the board may consider necessary. Number 3, to run an effective and cost-effective medical services to Nigerians. And lastly, to review and update medical findings and research from time to time. Federal Medical Center Ijebu-Ode, Ogun State will provide services in specialized areas like neurosurgery, cardiology, urology, orthopedics, pediatrics, internal medicine, radiotherapy, hair, nose and throat treatment, gynecology, psychiatry, nuclear medicine, and other fields of medicine that may be required by Nigerians. I therefore urge Mr. President and my fellow distinguished colleagues to take a giant step in the right direction by supporting this bill for the second reading. In line with Order 76. 3 of the Senate Standing Orders 2022 as amended, a compendium of the financial implications of the establishment of the Federal Medical Center Ijebu-Ode, Ogun State is hereby attached. Thank you, Mr. President, and thank you, my distinguished colleagues.
Thank you, Mr. President. I am Senator Baro Jibrin. I represent Kaduna. Mr. President, I stand to support this bill and commend the sponsor for having the foresight to bring forward this bill for legislation. Mr. President, Ijebu-Ode is a historical town in the western part of this country. Very historical, that has a lot of people in different parts of this country settling there. And its strategic importance to this nation makes it appropriate to make sure that we have a Federal Medical Center in that town. Mr. President, we all know the importance of having a sound health facility as proposed by this bill, situated in a very good place, in a strategic area, in a strategic town like Ijebu-Ode. We know that it has a kind of short proximity to Lagos, but the population of that town makes it necessary to make sure that we have a medical center there, federal medical center, to help to provide the necessary health facility or health give an opportunity to give an opportunity to the people of Ijebu-Ode to have access to good medical attention as required by the people of the area. Mr. President, I urge my colleagues to support this bill so that we can have a medical center located in the historic town of Ejobo. I so submit.
Those in favor of this motion, this bill be now read a second time, say aye. Those against say nay, the ayes have it. Clerk of the Senate.
Mr. President, distinguished senators, a bill for an act establishing a federal medical center in Ejobo and for related matters 2022 SB 379 second reading.
A bill for an act to establish the Federal Medical Center in Ode and for related matters 2022 second reading taken, and the bill is referred to the Senate Committee on Tertiary Institutions and Third Fund and Health, with Tertiary Institutions and Third Fund as the lead committee. The report back in 4 weeks. Leader of the Senate.
Mr. President, my highly respected and distinguished colleagues, the seventh order of the day is the second reading of the Nigerian Security and Civil Defense Corps Act 2003 Amendment Bill 2021. Distinguished senators will recall that the bill was read the first time in this chamber on Wednesday. Judge Sekibo to move the motion for the bill to be read the second time.
Distinguished Senator George Thompson Sekibo, Rivers East.
Mr. President of the Senate, my distinguished colleagues, I am Senator George Thompson Sekibo. I represent the Rivers East Senatorial District. Mr. President, thank you for allowing me to take the lead debate on a bill for an act to amend the Nigerian Security and Civil Defense Corps Act, Cap N146, LFN 2010, to make provisions for the mode of appointment of the Commandant General of the Corps. Mr. President and my colleagues, I wish to thank the President of the Senate for the opportunity to make the lead debate of this bill. Furthermore, I also wish to thank my distinguished colleagues who I am sure are ready to participate in the second reading of this bill. You will recall that this bill was read the first time on June 2nd, 2021. The bill seeks to amend the Nigerian Security and Civil Defense Corps Act, Cap N146, LFN 2010, hereinafter referred to as the Principal Act, to make provisions for the mode of appointment of the Commandant General of the Corps. By virtue of Section 1 of the Immigration and Prison Services Act that establishes the Board of the Immigration and Prison Services, the Board was mandated to be responsible for the administration of the Immigration and Prison Act respectively, as well as serve as the governing board of the Nigerian Security and Civil Defense Corps by virtue of Section 2 of the Nigerian Civil Defense Corps Nigerian Security and Civil Defense Corps Act. The board under Section 3 of the said Immigration and Prison Board Act have the power to appoint persons to hold or act in all the offices in the immigration services, prison services, as well as the Civil Defense Corps, and also confirm appointment thereof. It can be observed from the foregoing that the legislature intended that there should be uniformity in the appointment, promotion, discipline, and general administration of these three services. Regrettably, the mode of appointment of the heads of these services left out this legislature in the scheme of things, as the National Assembly had no input to make in the appointment of the heads of these three services, which is incongruous with the tenet of the constitutional democracy and the rule of law. To correct this anomaly, the National Assembly in 2019 repealed the Prisons Act and enacted the Nigerian Correctional Services Act. The National Assembly, in consideration of well-established constitutional, statutory, and international best practice under Section 3 of the new Prisons Act, withdrew the powers of the Board of the Immigration and Prison Services to make and confirm appointment of the Controller General of the Nigerian Correctional Services as currently designated and vested those powers on the President of the Federal Republic of Nigeria and the Senate respectively. Henceforth, the board is only to make recommendation for the appointment of the Controller General of the Correctional Services to the President, subject to the confirmation of the Senate. This new position of the law ensures that there are adequate checks and balances in the appointment of the Controller General of the Nigerian Correctional Services, which ensures strict adherence to the rule of law and good governance under a constitutional democracy. Regrettably, while the appointment of the Controller General of the Nigerian Correctional Services is in sync with constitutional, statutory and international best practice, the appointment of the head of the Nigerian Security and Civil Defense Corps was still left under the purview of the Immigration and Prison Services Board, as there was no commensurate amendment to the Enabling Act of the Nigerian Security and Civil Defense Corps. This is not only obtuse and irregular, as the intendment of the legislature is to have uniformity in the management, administration of the said three services. Furthermore, as the appointment of the head of the Civil Defense Corps is not in tandem with well-known best practices under a constitutional democracy, it had capped the ability of the National Assembly to exercise adequate oversight powers in the appointment of the head of the Civil Defense Corps, which is a critical agency required for effective internal security of the country. Mr. President and distinguished colleagues, under a constitutional democracy, it is the President that appoints heads of ministries, departments and agencies, subject to the confirmation of the Senate. This trend is also enshrined in our Constitution and laws of the Federation accordingly. Time will fail me if I am to mention all the sections of the Constitution and the laws of the Federation with provisions for the President to make appointments subject to the confirmation of such appointment by the Senate. However, suffice it to say that, save in the case of the Nigerian Armed Forces, no any other entity or person is mentioned in any section or provision of the Constitution or laws of the Federation with regard to confirmation of appointment by the President other than the Senate. Other jurisdiction. Even in other jurisdictions with certain similarity with our democratic parties, and more specifically the United States of America, which presidential system of government we practice, it is also their Senate that makes confirmation for presidential appointments. By virtue of Article 2, Section 2, Clause 2 of the United States Constitution, known as the Appointing Clause, the President of the United States of America is empowered to appoint government officials subject to the confirmation of their Senate. Conclusion, Mr. President. This bill, following well-established constitutional, statutory and international best practice, seeks to ensure that appointment of the head of the Civil Defense Corps is made by the President of the Federal Republic of Nigeria, subject to the confirmation by the Senate, thereby ensuring uniformity in the mode of appointment for the Civil Defense Corps as well. The bill, if passed, will help to strengthen the oversight powers of the Senate over the appointment of the Commander General of the Corps, ensure adherence to the rule of law by the President, as well as help to put in check the exercises of the executive branch of government over appointment of head of the Civil Service Corps, which have critical internal security implication for the country. Mr. President and my distinguished colleagues, the National Assembly is mandated to make laws for the good governance of the country, and it is my firm belief that this bill is in the right direction. I urge my colleagues, Mr. President, there is no financial compendium because there is no financial implication. It is only an administrative bill. I therefore urge you to support this bill for second reading and pass it into law.
Very distinguished Senator Gershom Henry Bassi, Cross River South.
Thank you, Mr. President. Gershom Bassi, Cross River South. Mr. President, distinguished colleagues, I rise to support this bill as moved by the most distinguished Senator George Thompson Sekibo. I think we treated something like this yesterday along the lines of the same bill which was referred to with regard to the immigration services. We have earlier treated that of the other agency, and I think this is the last of the three to be treated. So I think the arguments that apply to all the other two agencies which we passed in these chambers equally apply to the case of the Civil Defense Corps. So I